Hi, my name is Daphne Cahill, and I recently just completed an internship at Durango Fire and Rescue. And for my final project, I decided to create a Stop the Bleed kit. And this is kind of just about stopping the bleed in general and also shows my kit and instructions on how to use the different items in my kit. So, the first thing I want to talk about before actually getting into my kit is basic trauma care responses. So, for this, we break it down into three letters A, B, and C. A stands for alert, and this means that someone or yourself is calling 911 to get an EMT rig or something on the way, so you have that extra. Help for the injury. And then the next letter is B, and this stands for bleeding. This means that you're actually going to locate the injury, and you may have to remove clothing if needed in order to find the bleed. And then the last letter is C, and this means compress. And this is when we're going to start applying the pressure to stop the bleed. And we can do this in a couple ways. We can cover with a clean cloth or gauze and apply pressure. We can use a tourniquet, which cuts off the major arteries in the extremity, or we can pack using gauzes or clean cloth to stop the bleed. So, another thing that I want to talk about is professional or personal protective equipment, otherwise known as PPE. And so, helping people is a big part of stopping the bleed, but we also need to remember and practice personal safety. It's really important to keep yourself safe during these situations because we want less patients, not more. And then this is kind of just how to identify a life threatening bleed. So, some of the key giveaways that it is a life threatening bleed is blood is spraying out of the wound, there's nonstop bleeding, there may be a pool of blood on the ground, some form of clothing may be soaked with blood. This could also be a loss of a limb or an extremity, and the victim is confused or unconscious because when we lose a bunch of blood, we're also losing oxygen that can't get to our brain to properly make it work. So then this is my actual Stop the Bleed kit. I decided to go with a little fanny pack. I thought this would be easy to carry, number one, and also small enough to be able to bring places with me. And then here's my actual kit. So this kit includes an ABD pad, band-aids, a hazard waste trash bag, some gauzes, a tourniquet, medical tape, self-adherent bandage, sterile gloves, petroleum gauze strip, a sterile gauze roll, and an ACE bandage. So this kind of goes back to the idea of PPE, but these are sterile gloves, and this is one of the most crucial parts of personal protective equipment. It just really protects your hands from any possible contamination. And then these are just regular band-aids. I'm pretty sure everyone's seen these before. These are used to stop littler cuts that aren't a life-threatening bleed, but they can be really beneficial to these tinier cuts to prevent contamination or infection, and also just to stop a bleed if it's more little. And then next is a gauze sponge, and these are mainly used for packing, and these can also be used for a form of pressure. These can be folded to be used for applying pressure, and these also act kind of the same as a band-aid as a protector for open wounds to limit the risk of infection or more tearing. And then this is a combine ABD pad. These pads are used for serious bleeds in places like your abdomen and legs where there are serious arteries. This also may be used if it's kind of an uncomfortable place where you couldn't really pack or wrap the wound. And then medical tape is pretty self-explanatory, but this is mainly used to just keep things in place, especially like gauzes and other dressings. And then a tourniquet, like I said before, these are mainly used to cut off arteries, and this can stop heavy bleeding. These tourniquets fully stop blood flow in your extremities. This is really important for um, just stopping the bleed. And also, this may seem kind of extreme, but our extremities can go at least 8 hours without blood flow and still be functionable after you regain blood flow. And then this is another part of PPE, kind of, or just overall protectiveness, is a hazard waste bag. These bags are used to throw away any contaminated trash, such as sterile gloves, gauze, or anything that has been used during the emergency. This just keeps everyone safe, and you wouldn't be able to throw these things away in a regular trash can, so it's good to have these on hand. And then an ace bandage, this is really used for wrapping and keeping things in place. You can also use this for pressure and compression on sprains and breaks as well as injuries. A petroleum gauze strip are used for healing and contains moisture to help with the healing process. This would also be used if you had an injury in a spot that was more difficult, kind of like the ABD bandage. And then we have a sterile gauze roll. These are used for cleaning wounds, and these can also be used as a form of packing or for pressure. These are kind of just similar to a gauze, but they're a little bit bigger and contain a little bit more. And then we have a self-adhered bandage, and this is the last thing in my kit. And these are really good for wrapping an injury because they can stick to themselves, so you know that it's not going to come apart while you're maybe transporting. These are also used to apply pressure, and you can wrap them pretty tight to keep that pressure in place. So yeah, these are also really good just for overall injury. So this is my Stop the Bleed kit. I hope this video was informational and helpful, and you could probably use it to make your own Stop the Bleed kit. We live in outdoorsy Durango, Colorado, so it's really important to have these things on hand and to be able to stop a bleed if one of your friends is experiencing an injury.